Everyone for joining us here today, and thank you to Uni and for all of your incredible work. The suicide rate in Utah, particularly for young people, has become a public health crisis. According to statistics, Utah has the 6th highest overall suicide rate in the country, according to the National Centers for Disease Control and Prevention. We need to do more to understand what puts a young person at risk of tragically ending their life. When a young person commits suicide, it causes heartbreak for family and friends and affects an entire community. They're left to wonder what, if anything, could have been done to prevent it. As we've seen with other mental health issues, such as the opioid epidemic, Utah is taking action, and local leaders have stepped forward to look for ways to prevent suicide and to better understand who is at risk and bringing awareness to the issue. When I was the mayor of Salt Lake County, I worked with Ross Van Vranken and his team at Uni to form their Mobile Crisis Outreach Team, or MCOT, to assist police officers who are called to a scene where someone is experiencing a mental health crisis and that is threatening to harm themselves or others. It's no surprise that Ross and other dedicated professionals at the University Neuropsychiatric Institute would lead the way with a comprehensive response team and with research to better understand how to identify those at risk and how we can best and most effectively respond to that risk. But all this great work won't go forward without resources to do so. I supported 2 measures included in a bill passed by the United States House of Representatives, continuing my passion and support for this important work that's happening here in Utah. One increases grant funding by $2 million to the CDC's Injury and Prevention Control Suicide Program, and another $2 million for the Substance Abuse and Mental Health Services Administration, which distributes grants to colleges and universities. The American Foundation for Suicide Prevention, which receives over 2 million annual calls to the National Suicide Prevention Lifeline, of which Uni participates and supports, they've called on Congress to support both measures. The National Lifeline, if anyone out there is at risk, the National Lifeline is 1-800-273-8255. Ross will be able to provide us some high-level numbers about crisis response here in Utah and the work that's being done. I will keep working to increase the financial support to these folks that are saving lives and making a difference right here in our community. Suicide, like other leading causes of death, like cancer, can be addressed if we take the same public health awareness and prevention approach that we have with other public health crises. So at this point, I'm going to turn it over, as was mentioned, to Dr. Doug Gray and Ross Van Vranken, and then our guest, Julia, who has courageously agreed to share her personal story with us today. So we'll start then with Dr. Gray.
Suicide rates are climbing in the United States and in Utah. It's an epidemic that we need everybody on board to address. Especially true for the Rocky Mountain states, and I'll talk about that in a bit. As Congressman McAdams mentioned, we're 6th in the country in suicide rate for Utah. And more soldiers now die of suicide than in battle. So this is a problem we have to address. I've looked around the U.S. and the world at programs that actually reduce suicide, and they require multiple interventions at many layers, and it requires cultural change, and it takes time. And that's what we're doing in Utah. I've actually been doing suicide prevention for 25 years. The first 20 years it was like slogging through the mud. Things happened slowly, and most suicide prevention happened out of the trunk of my Honda Civic. I had a bunch of boxes and stuff for media, stuff for clergy. But the last 5 years, there's been exponential growth in everything. For example, we got a suicide prevention coordinator for the state, Kim Myers, who's terrific. We got a suicide prevention coordinator for the school system, Kathy Davis. She's terrific. Michael Staley recently was hired by the medical examiner to help us with suicide data. He's terrific. And we have a school program, Hope for Utah, putting hope squads in our schools all throughout Utah and now other states. I want to emphasize that although there's a lot of leadership in the community and at uni, most of our suicide prevention is driven by an army of volunteers. There are hundreds and hundreds of people helping us as volunteers, and I appreciate every one of them. Separate from our community effort, we also have to look to the future on future prevention efforts, and that requires research, and research is hard, takes time. The University of Utah is a leader looking at the genetics of suicide. If you're adopted at birth, your suicide risk comes from your biological family that you didn't meet, not from the family that meets you. I know that sounds strange, but genetics is about 45 to 50% of suicide risk. And we have world-class genetics at the U, and they've identified genes that may put people at higher risk. The altitude hypothesis, Perry Renshaw is the leader there, came out of the University of Utah. It demonstrates why the Rocky Mountain states have much higher suicide rates than the rest of the country. At altitudes above 2,000 feet, suicide rates go up and up and up. And so there's an altitude effect that some people, not everybody with depression, but some people with depression have treatment-resistant depression due to altitude. And our teams of researchers are looking for new treatments for high-altitude depression. We just started through the Office of the Medical Examiner, and thank goodness we have a medical examiner who really cares about suicide and reducing suicide rates. We just started the largest study ever done in the world of adolescent suicide. That's underway. We've had great help of local government through our state legislature. Steve Ellison, is our champion in the legislature. He's been great. We do need help at the national level, so I'm so pleased that Congressman McAdams is here to help and has already generated some funding for suicide research nationally. And we'll be meeting soon to talk more about how he can help on a national level, because I know he's very interested in that. And I appreciate everything he's doing, and it's great to have a new partner in suicide prevention. So thank you.
So Doug talked a little bit about the research side. I'm going to talk a little bit about the people side and the clinical interventions that we provide, not only here at the university but throughout the state, and the collaborative that's come together to kind of really address this issue. Representative McAdams defined this as a public health crisis, which it is, and it is taking some of our best and brightest who are, and so it's really kind of incumbent upon us to kind of address some of this. Dr. Gray talked about how complicated suicides are. We don't have a lot of definitive information in terms of what actually causes suicide. There are many reasons why people choose to commit suicide. So it's multifactorial. There's no one cause, and there's not going to be one solution. We need to better understand how we can attack this crisis in a coordinated approach with local, state, and national strategies in the same way that we've been able to confront other healthcare crises in this country. Today, we're here to show our appreciation to Representative McAdams for his sponsorship and providing additional research resources so that we can address this, so that community members, family members, providers, and loved ones can better understand how to support, educate, and intervene early when somebody's beginning to think about hurting themselves. Most people don't want to die. They just simply don't want to go on feeling the way they feel. They don't want to have to continue to address their depression, anxiety, some trauma perhaps in their life, or the emotional pain they're going through. The University of Utah Health and Uni for a number of years have really focused on suicide, but to Doug's point, it really has kind of picked up a lot of momentum in the last 6 or 7 years. And it's made a big difference. And part of that has to do with kind of strong relationships and collaborations that's come together to kind of provide resources to add new programs, intervention, and crisis response throughout the state. That wasn't possible a few years ago. Our 24/7 comprehensive crisis center is staffed by licensed clinicians who provide real-time counseling and crisis intervention for the statewide crisis line, for the National Suicide Prevention Lifeline that Representative McAdams mentioned, the Warm Line, our mobile crisis outreach team, and the Safe UT app. In the last 3 years, we've provided telephonic, digital, and face-to-face intervention on over 264,000 unique individual contacts. That's a 70% increase from where we started 3 years ago. That does not include all the other work that's going on. It doesn't include the thousands of folks that we intervene with through the University of Utah emergency room, through the University Health community clinics, or through Uni, both on the inpatient and outpatient side. It doesn't really recognize all the people in the community who are stepping up and trying to address this issue. The public education system, law enforcement, public safety, communities, community councils, and it doesn't really reflect what all the other healthcare systems and agencies in the state are doing. So this really is a community-based cultural phenomenon that we're undertaking at this time. We wouldn't be here today if it weren't for all the help of all those different folks. Doug mentioned a few people. I'm going to address a couple other. I wanted to thank then Mayor McAdams for supporting everything coming out of Salt Lake County. Council, Tim Whalen and his group. I need to thank Representative Steve Illison and Senator Daniel Thatcher, who have sponsored numerous bills in the Utah legislature to get us funding. And I don't want to leave out the Utah legislature because they've really come to the table and helped us out a lot. The Attorney General's office, Sean Reyes and Rick Cantrell. Need to thank the State Division of Substance Abuse and Mental Health, Doug Thomas, Jeremy Christensen, mentioned Kim Myers, and also Governor Gary Herbert, who stepped up and created the statewide suicide prevention task force that Lieutenant Governor Cox chairs with Representative Illison. The Utah Hospital Association, Greg Bell and his efforts, and the community mental health centers, and all faith-based organizations in this state that have all gotten behind this. So we are making progress. It's not fast enough, as Doug mentioned. It's going to take time. I know what our role is going forward is to continue to focus on preventing suicide on a statewide basis. We need to increase or augment the crisis response system so we're in the moment when somebody's really struggling. We need to eliminate the stigma and discrimination around their expression of discomfort, depression, anxiety, and related trauma that they feel. We need to open the conversation, and that's probably the most important part with suicide, with on an individual and a macro level, so that we can better address the struggles and the experience that people go through. And I'd like to turn it over to Julia, and this is really what it's about. Everything else we do is just for Julia. So, Julia.
Well, hi. My name is Julia Ludlow. I am 17 years old, a recent high school graduate from the Layton High School of New Ames that's paired with Weber State. I had the opportunity to graduate with my general associate's degree in high school, and I have battled with depression since 9th grade. Trying not to cry. My battle with depression started when I was very, very young. I have been struggling with it my whole life. It was very genetic for me. And I, had these issues with suicide, depression, and for the longest time I didn't talk to anyone about it, and I didn't have a conversation. And when 9th grade rolled around, I decided that my best option was to attempt suicide. And just saying that word, I can feel the tension in this room alone. That is one of the things that I've heard mentioned that needs to change about suicide. I am standing here because of the suicide prevention program, the Hope for Utah Hope Squad program. It was the main thing that saved my life. My best friend found me. I'm sorry. My best friend found me when I was trying to swallow pills because I wanted to die. And she asked me if I was okay, and that was all it took. Just 2 words, 3 words, "Are you okay?" Because she knew and was educated enough to handle the situation, and she knew what to do. Just that small bit of education, knowing how to handle these issues, just like you would know how to handle the flu and any other illness, because that's what this is. It is an illness. I have a physical problem that needed to be addressed, and I feel very strongly that these issues need to be addressed, that these measures need to be taken, because without them, people are going to die. People like me are going to struggle, and they're not going to make it. I had a support system in place, my mom, my dad, my family. They knew immediately what to do and where to take me because they had the education and the opportunities to learn about these problems. Overall, I'm a relatively normal person. People suffer with this every day, all around us, all the time. When I started seeing my psychologist who helped diagnose me and figure things out, he asked me how many people in my school that I thought had depression, and I answered 50%. Because I meet so many people that struggle with these problems and that have these feelings, but they don't know what to do with them. And without the resources that are being provided and without the funding, they're not going to have them for much longer. And so I'm pleading with anyone listening, please fund this. It's so important. I'm sorry my words are so short, but this is all I've got right now. So thank you for listening to me, and thank you for all being here.
If there are any questions, or we can do one-on-ones as well.
Yes.
Okay. Thank you.
Is she somewhere?
All right. Thank you, everybody.